Hi, everyone. My name is Sandy Stemp, and I'm RENA's Chief Operations Officer.
Hello, everyone. My name is Sharon Magor, and I am Marketing and Communications Manager.
Hello, everybody. I'm Krystyna Ostrowska. I'm the infectious disease physician and the medical microbiologist.
And in the last 8 months, aside from all the things that we usually do at RENA, you would have heard from all of us here. And we have been giving out regular messages to staff and to families, really making sure that we try to get the right information available to everyone in order to protect ourselves and to really support the individuals at RENA the best that we can. We've usually communicated quite frequently, and this time we thought it might be a great opportunity to have a bit of a chat with RENA's infectious disease specialist, Dr. Krystyna Ostrowska. And you might be asking yourself, why are we talking to Dr. Ostrowska now? Well, really, there's two big reasons. The first one is that we're in the midst of a second wave of COVID and really can't let our guard down. We know it's not easy on you. It's not easy on the people we support. It's not easy on the families. But we have to keep going and really looking at those very important infection prevention and control measures that we have put in place. And the second reason is that along with the second wave, the flu season is upon us. And every year, and this year being obviously different, but everybody is encouraged to take the flu shot in order to protect the health and safety of yourselves as well as your loved ones. The flu shot is even more important this year because of the timing of the pandemic. Some experts are cautioning against what they call a twindemic situation, where you could be having both the COVID-19 infection as well as the influenza infections at a very high number. The bottom line is we have to follow the common sense infection prevention and control measures, and we have to get the flu shot. And doing both those things will help us be safer and healthier in the long run. But don't take it from myself. We have today an expert, Dr. Krystyna Ostrowska, and she has really been on this journey with us. And we welcome her as a member of our family, and really walking beside us and helping us, advising us, and assisting us on how to best protect ourselves and how to put things in place that will help us be the safest, the individuals, as well as all of our staff. So Dr. Ostrowska, welcome, and thank you so much for spending some time with us today.
Pleasure to be here.
So one of the things that we asked our staff is to give us some feedback about their perceptions and also some challenges in getting the flu shot. And we collected these, and we thought maybe we could get your input on what you think. The other piece is that RENA right now is engaged in an awareness and an education campaign. And it's really out there to encourage our staff to get vaccinated. We're trying to make it fun. We're trying to make it interactive, but we're also trying to provide good information. So let me just ask you one of the questions that had come forward. So some staff are worried that after they got the flu shot in previous years, they felt that they got ill or that they got the flu, and they're wondering if this would happen to them again.
I think that's a very valid question. I can think of several possibilities how this might have happened or why they felt this way. Let me just say that you cannot get flu from the flu shot. And we can elaborate on it maybe in if you have consecutive questions like that, But that's just to say that it is actually impossible to get the flu from the flu shot. However, when you get the flu shot, let's say you get it today on Friday, your body will begin to develop an immune response in form of antibodies to that flu shot, so that eventually you get protection against the circulating flu. And the production of those antibodies starts now, today, but it takes up to 2 weeks to have a fully developed immunity. So within those 2 weeks, as the body is working towards it, you could be exposed to flu and actually get the flu while your immune system is getting fully responsive. So that's a possibility, but that's not because you got the flu from the flu shot. It's because you were unlucky and simply got exposed to someone with the flu, and yet your immune system just wasn't ready to battle it from that vaccine that you just received. The other possibility is that you actually, it's not the flu that you had, the symptoms are actually attributable to another viral illness. And unfortunately, there are a lot of those viral illnesses circulating. It could be a simple rhinovirus, the common cold. It could be a virus that's called metapneumovirus. It could be parainfluenza virus. There are lots of them. And there are probably also viruses that may mimic flu, but we just have no way of testing for the presence of them. So there are a number of reasons why you might feel this way, but you cannot get flu from the flu shot itself.
Well, that's really a great explanation. And I do know that this time of the year, there's lots of different, let's just say, bugs floating around.
Right.
So
Yes.
I think that many people, you may catch it at any time, and it could be the day after you receive the flu vaccine.
Yep. Right.
So it definitely, we certainly hope not, but sometimes it does happen.
Right.
I think some people are also wondering about the effectiveness of the vaccine, and they want to know, does it really help?
Yes. So the effectiveness of the vaccine is sometimes difficult to measure, but there are sort of two large components to it. First, I would start with our individual immune system. And the response to the vaccine varies from individual to individual. First of all, age plays a very important role because our immune system is aging with us, which is, not a big surprise. But an immune response of a 25-year-old healthy individual will be very different than an immune response from an 85 healthy individual, simply because our immune system undergoes the aging process and therefore weakens with age. So that's a very important difference in mounting the immune response. And why is that important? It's important for what we call herd immunity. So it would actually be very important for young people to get vaccinated, so that by mounting a very good immune response, they can protect those whose immune response will actually be weaker to the vaccine. The second important part is that your immune system is also influenced by what we call comorbidities. And so we know that, let's say, people with chronic lung disease, with diabetes, with developmental disabilities, don't mount the same immune response to the vaccine regardless of age. So that's another reason why their immune response will be weaker than, let's say, a healthy 25-year-old as opposed to a diabetic who is 25-year-old or someone with pre-existing other comorbidities of the same age. And the other big factor is that every year the flu vaccine is manufactured based on, for most part, last year's so-called circulating strain, which is the actual influenza virus that's circulating. And there are quite a few of them. There are a couple of strains of influenza A and then a couple of strains of influenza B. And so based on what was circulating last year, also based on what's circulating or was circulating in the southern hemisphere, which had their winter as we had our summer, we are manufacturing as best as we can a vaccine that matches those several strains. The influenza, however, is a very tricky one, and during this period of evolution as the months go by, influenza viruses undergo what we call changes called drift. So by the time it arrives at our door, which is sort of now, it might have undergone some mutations called drift, and therefore what we are producing will not quite match what arrives as a wild influenza, as a circulating one in the community. And that's where we may get a mismatch between what's circulating and what was produced. And sometimes the influenza doesn't make those huge changes within itself, and the match is perfect. And in some situations, unfortunately, is not as good as we would like it to be. But there's not much we can do about it other than be able to manufacture, vaccine in a much, much faster way, which we don't have at this point, but there's a lot of research and a lot of work done to address that very issue. So I'm sorry for a very complex answer, but that's why it's not a simple yes and no.
But it sounds like certainly that even if it's not a perfect match, that there will be elements of protection.
Absolutely.
And that those elements of protection are really, really important, especially for the most vulnerable. And I guess we have heard it a lot with COVID that this is not so much what we just do for ourselves, it's what we do for the most vulnerable. And
yeah. You know, I was actually talking a little bit about it at our earlier meeting today, and that's it. It's really a notion of what business are we in, and we are in the business of helping people. But before we help someone, we don't want to harm them. So there's this beautiful, I love Latin, so I like to quote it whenever I can, primum non nocere, which basically means first do no harm. And I think that by thinking about influenza vaccine as something that will protect us, but also we will protect others, is very much in line with first do no harm.
Absolutely. And I appreciated so much of what you said, that sometimes we feel out of control, that there's not a lot we can do.
Right.
And with the flu vaccine, this is a really concrete thing that we can do and that will benefit and help other people. I think that is an incredibly important concept.
I think so, yes.
So another question is around sometimes people are thinking about the flu and they're also thinking about COVID at the same time. And I guess this is similar to maybe the first question about people getting worried about having symptoms that might look like COVID, and what does that mean? I guess the other question in this regard would be, what are the most common side effects for the flu vaccine, and does it mimic in some ways COVID?
So in terms of symptoms, there will be an overlap between the COVID symptoms and the flu itself, the flu symptoms. People will have fevers and chills and sore throat more or less, but achiness and maybe runny nose or headache. So there is an overlap. There's an overlap in all viral illnesses in that sense. And just by waking up and feeling lousy, you may not be able to tell, particularly when we have a season of influenza approaching. You won't be able to tell what's what. However, the side effects from the actual influenza vaccination are very different. First of all, the serious side effects are exceedingly rare, and you would know that something is really very wrong and you have to go to the hospital to get checked. But in most situations, the symptoms are very mild, and a lot of the times it's actually a local reaction, some pain at the site of the injection and some redness and inflammation. But the serious side effects are exceedingly rare. In that situation, really, the only thing that one can do is go get checked, and you get your COVID test, and that's important because if you have it, you know what to do. If you don't have it, you know what to do. But it's actually important for you and everybody around you, both at home and at work, to know whether this is COVID or not. Ideally, we should be able to get an influenza rapid test at the same time, so that you know which is which, and then guard against it. But this will come up, and it will come up hopefully infrequently, but we will have that situation, and really the best thing to do is just get tested. The tests are available, and then sort it out for yourself and for those around you, who I think will be a lot more anxious now than in the pre-COVID years.
Absolutely. And I know that myself and my family were just vaccinated last week. And you know what? It was great. None of us had any symptoms of anything. In fact, some years I find the vaccine, feels, and maybe it's just because I've moved my arm more, feels a little bit more tender. But this year, hardly anything. So I think it's one of those things, again, that people are worried about what will happen after a vaccine. But the reality is, most of the time it might give you a bit of a sore arm. Probably not best to exercise or something after you receive a vaccine. But other than that, very rare to have really any major effect. So that's great.
Yes, I think actually it has something to do with the adjuvant, because I had reactions to a sore arm in the last 2 years. This year, absolutely nothing. The way it is also not so much the formulation of the vaccine, i.e. specific content of the attenuated influenza, but whatever else they add to it. So this year's formulation is, I'm going to say, a breeze.
Yeah, it's quite good. Really few and not really a sore arm even. So that's
and
great
the gym
news.
is closed anyway, so
that's right. No weightlifting. Some staff, I guess, must be pretty lucky, but some people say, I don't get sick, and in other years I didn't get the flu shot and I never got sick. So, why should I get it this year?
That's right. It's like for the reasons that I've mentioned, right? We work you just got lucky, right? You just got lucky, and then you could continue to get lucky, and that's fine. But again, remember that you may not get sick, but you may get minimally sick, but you expose other people that you work with, that you care for, who are extremely vulnerable. So why create a situation where we make them more vulnerable than it is necessary? I think we're here about risk reduction. And somebody might say, well, you know what, that's all great, but this time we're all wearing masks, and so we're washing our hands, so why should I worry about influenza? And my response to that is, well, if we're really, truly honest with ourselves, are we 100% compliant with mask wearing, distancing, and hand washing? And unfortunately, the answer is no. And then we take our masks off, and then we contaminate our hands with it, because we cannot possibly be so aware of our whereabouts and what we're doing and every step we make. It's just impossible. We wouldn't be able to do our jobs. That it is really foolish to think that this is going to be good enough. So those are the reasons why we should consider the flu shot.
I think it's once again about when people say, well, I like to trust my luck. But in this case, it's not just about trusting your luck, it's trusting the most vulnerable luck. So yep. That's the difference, I think, is that sometimes we can make individual decisions that only impact ourselves. But in this case, it will impact the people around us.
Yeah, absolutely. Absolutely. Yeah, by now it's a cliche. We're in it together.
It's a cliche, but worth repeating, because
yes.
I think that sometimes, we live in a world that often values very individual choices. And something like a pandemic, even though it's a very sad and challenging time, it teaches us lessons that we're not in it alone, and that what we do impacts on all the other people that we know and love and care for. So yep, I think that's absolutely true. Some staff have asked about what's actually in the vaccine. I think for many individuals that this whole science of vaccine, this whole science of infection prevention and control is really complicated, and really kind of a new world for many that are trying to find out more information. And so with a lack of really understanding of like what's in that vial, some staff have said, I'm not sure if I trust what's in there. Can you help us to understand what's inside the vaccination?
Mm-hmm. Sure. How much time do you have, actually? So that's the bigger question. But so as I mentioned earlier, we, generally speaking, there are several strains of influenza virus circulating in the community on an annual basis. And then we essentially see the two main ones, influenza A and influenza B. Interestingly, usually influenza A is the sort of the first wave. And then the influenza B tends to come in the second wave. There are oftentimes those two peaks, the early and the late. So, and as I mentioned, based on what we know from previous years and based on what we know what's currently circulating or circulated in the Southern Hemisphere, we then take those viruses, those specific strains, and basically incubate them. And they have to be incubated, in this case, in egg embryos. So I think these are chicks or I forgot which one. But we need to propagate. We need to allow for those viruses to be alive and then multiply. And they can only multiply in those very specific embryo-like environments. And so then we create many, many, many of these copies of few strains of influenza A and few strains of influenza B. And then we take them and then we basically say, we are now going to inactivate those viruses so that, I try to think, how can I best explain it? And it's like basically you have a car and the car is ready to drive, and that's your influenza, the active virus that obviously in the scientific term can create an infection. But then what we're doing is we're basically now removing the wheels from the car. So you can still recognize the car. The tank is full of gas. It's ready to go, except that it can't go because it's got no wheels. And so this is what happens when we do that, and we call this inactivation of the virus. And by doing so, when we inject it into your arm, the immune system reads it as, aha, this looks like influenza, so we can generate immunity, but we cannot generate the actual illness because the wheels are off, so to speak. So it's immunogenic, but not generating an illness. And you will have some, people will read, oh, this is inactivated virus, or this is attenuated virus. So these are various methods where we basically disarm the virus so that it will not create an illness, but it is potent enough to generate the immune response. So that's what's in those vials. And the other thing I wanted to say is that, unfortunately, our immune system is unable to generate a good immune response to the influenza B. So no matter how hard you try to have a few strains of the influenza B in that vial, our immune response is not as robust as it is to influenza A. And so you got your shot, your body is turning, your immune response, all these antibodies are floating around, and you are unfortunately exposed to influenza B, which is kind of usually late in the season. You may get sick. You may get a mild form of influenza simply because your immune system is doing its best, but not good enough to completely make you free from symptoms.
Mm-hmm.
That sounds really interesting. It's almost like the vaccine tricks our body into saying, hey, look at me.
Recognize me? This is me.
Yeah, look at me. And you need to build an immune response to create that protection in your system. And it has to look enough like it so that the body really reacts to it to build your level of protection.
And in a very specific way, right? To the influenza and not some other virus.
Right. Yeah, that's right. So it has to be, you're looking at the influenza virus, and you have to have something that looks exactly like it in order for your body to really produce that. So I think people need to just be aware that it is what you need in order for your body to react to it, to build the protection so that, and again, certain flus, there may be more protection, but it's certainly protection. So
right.
If you're looking at a choice between, oh, well, if it's not 100%, then why take it? And the why take it is because even some protection may really help reduce your illness, maybe the severity of it, like how sick you get, and maybe how many days you're sick too, right?
Absolutely, yeah. It can reduce the severity of the illness, and what we see in My practice is that when people get sick with influenza, really sick, and require admission to the hospital, unfortunately, influenza is one of those viruses that likes to invite other guys to join. And what often happens is people then end up with a bacterial infection on top of influenza. We don't see this with COVID, but we sure see it with influenza, and then you have a double whammy, and it is not pretty. So it's really important to make sure that you get that flu shot, because in a way it protects you against influenza, and by extension it may actually protect you against co-infection with bacterial pneumonia, and those are unfortunately quite deadly.
Those nasty bugs that want to piggyback.
Yeah. Oh yeah.
So that, and again,
it's like influenza says the door is open. Hey, come in. So not a good situation.
No, and certainly for people who are really vulnerable, that can be the last straw, right? It can really be the tipping point for somebody who's quite elderly. So it can be very serious, and that's why with influenza, every year it's serious, every year it's important. And I think that this pandemic has shone a light on how important it is. And that's why many countries around the world right now that went before us in regards to the influenza season have had a huge uptake because it's so important this year.
Oh, yeah.
It's really shone a light on something we need to do every year, but so important this year.
And something absolutely preventable, right? So I think that's also an important message, is that you can actually do something that is quite effective in protecting yourself and the society at large. And we've seen massive uptakes in many countries, uptake for influenza vaccination. So honestly, I'm hoping that this is what we will see. We have actually seen an incredible uptake of vaccination in our hospital, and the vaccination started, I think, about 2 weeks ago. Well, I got mine 2 weeks ago, so 3 weeks ago, and people were it was an unbelievable response. So hopefully this will continue and it will trickle down to society at large.
And certainly, I mean, all you do is have to turn on the television set to hear about what demand there is, because many people's awareness now is much higher, and people are really understanding this is a really important thing we can do. This is, something for not only my safety, my family's safety, my workplace safety, and something that's very practical that I can do. And I think one of the things here at RENA is that we're very, very fortunate that we have had many partners step up, that we're able to have many options for flu vaccinations, and it's never too late. So even if staff may have missed, if a team came to your location, there'll be other opportunities for vaccinations, and there's many choices. And so I always say to people, even if you are unsure at the beginning and now you wish to get it, there's absolutely that opportunity, and really important to take advantage. So I thank you so much. This has been a wonderful chat. I've really enjoyed it. I think that you've really addressed a lot of the questions that staff have had, and I really think that you've provided some great information. And as we mentioned many times, there's things that we can't control and things we can. This is one of those things that we definitely can take control of to really help everyone in our lives. We know that this is a personal decision. We're really hoping that all of you make the right one for yourself, your family, and your coworkers. We thank you so much for taking the time to watch this interview. Again, thank you to Dr. Ostrowska for taking, precious time out of your very busy day. I always say Dr. Ostrowska, I think, has about 10 jobs. And we so appreciate that she is looking out for us and the developmental services sector, and really helping to provide us great information. Thank you so much.
You are most welcome. You are most welcome. Anytime. I will have the time for you. You know that.